Welcome to Online Medical and Nursing Education channel. In this video lesson, I have included 65 previously asked questions from AIIMS Bhopal Staff Nurse Examination 2016. Let's go to the class. Question number 1. Dengue fever is caused by bite of which mosquito? Option A. Culex. Option B. Mansonian. Option C. Mark Spitz. Option D. Aedes. Correct answer is option D. Aedes. Question number 2. ALU in the computer system stands for option A. Application Logic Unit. Option B. Array Logic Unit. Option C. Arithmetic and Logic Unit. Option D. Alternative Logic Unit. Correct answer is option C. Arithmetic Logic Unit. ALU in the computer system stands for Arithmetic and Logic Unit. Question number 3. Who created history by winning a record-breaking 23rd gold medal of Olympic history at Rio Olympics 2016? Option A. Carl Lewis. Option B. Usain Bolt. Option C. Mark Spitz. Option D. Michael Phelps. Correct answer is option D. Michael Phelps. Question number 4. Chemical coagulant used to treat raw river water is option A. Alum, option B. Sodium chloride, option C. Chlorine, and option D. Potassium permanganate. Correct answer is option A. Alum. Question number 5. MS-DOS is an operating system that has option A. Command line interface, option B. Option for mobile device, option C. Graphical user interface, and option D. Open source origin. Correct answer is option A. Command line interface. Question number 6. Which of the following is the correct sequence of the smallest to largest unit of storage size? Read from left to right. Option A. Mega, tera, giga, kilo, and penta. Option B. Kilo, mega, giga, tera, and penta. Option C. Kilo, mega, giga, penta, and tera. And option D. Kilo, mega, penta, tera, and giga. Correct answer is option B. Kilobyte, megabyte, gigabyte, terabyte, and pentabyte. Question number 7. The normal composition of oxygen in the environment is option A 40%, option B 30.93%, option C 20.93%, and option D 50%. Correct answer is option C 20.93%. Question number 8. If clock of Delhi display 1 p.m. then at the same time clock of Dubai will display option A 2 p.m., option B 12 p.m., option C 11:30 a.m. and option D 10:30 a.m. Correct answer is option C 11:30 a.m. Question number 9. In the following questions, find the word which means the same as given group of words, that is period of 1000 years. Option A decade, option B century, option C centenary, and option D millennium. Correct answer is option D millennium. The period of 1000 years is known as millennium. Question number 19. Indira Awas Yojana is meant for which population? Option A semi-urban, option B rural, option C urban and rural, and option D urban. Correct answer is option B rural. Question number 11. Man is a social animal. Who said this? Option A Christo, option B Pluto, option C Spencer, and option D Aristotle. Correct answer is option D Aristotle. Question number 12. The umbilical cord contains option A 2 arteries and 1 vein, option B 1 artery and 1 vein, and option C 2 arteries and 2 veins, and option D 1 artery and 2 veins. Correct answer is option A 2 arteries and 1 vein. The umbilical cord contains 2 arteries and 1 vein. Question number 13. Enuresis means option A, loss of control of urine, option B, breast holding, option C, loss of control of stool, and option D, loss of control of vomit. Correct answer is option A, loss of control of urine. Question number 14. The principle of effective leadership is least likely to involve option A, one group commanded by one leader, option B, one group should always have an objective, option C, accountability is delegated to the members of term, and option D, patient first policy is applied. Correct answer is option C, accountability is delegated to the members of term. The principle of effective leadership is least likely to involve accountability is delegated to the members of term. Question number 15. Which of the following are inventory control methods? Option A, HDL analysis and FAD analysis. Option B, DRF analysis and DEL analysis. Option C, ABC analysis and VED analysis. And option D, FED analysis and LDL analysis. Correct answer to the question is option C, ABC analysis and VED analysis. Question number 16. The ability of human body to protect itself from pathogens is known as option A, secretions of hormones, option B, hypersensitivity, option C, locomotion, option D, immunity. Correct answer is option D, immunity. The ability of human body to protect itself from pathogens is known as immunity. Question number 17. Which of the following is fourth cranial nerve? Option A, abducens, option B, trochlear, option C, trigeminal, and option D, facial. Correct answer is option B, trochlear nerve. Question number 18. The major portion of calcium is found in which part of the body? Option A, blood, option B, heart, option C, muscle, and option D, bone. Correct answer is option D, bone. Question number 19. The first aid treatment for choking is option A, call for ambulance, option B, give something to drink, option C, try to remove the object with your fingers, and option D, give 5 sharp back blow between shoulders and blades. Correct answer is option D, give 5 sharp back blows between shoulder blades. Question number 20. The power which is exercised because of appointment to a higher position is referred as option A, exclusive power, option B, expert power, option C, reward power, and option D, referent power. Correct answer is option A, exclusive power. Question number 21. The nurse is assessing a patient's abdomen. Which examination technique should the nurse first do? Option A, inspection, option B, percussion, option C, auscultation, and option D, palpation. Correct answer is option A, inspection. Question number 22. How many antenatal visits on a minimum should be recommended for an ANC mother? Option A, 6 visits, option B, 4 visits, option C, 1 visit, and option D, 5 visits. Correct answer is option B, 4 visit. 4 antenatal visit on a minimum should be recommended for an ANC mothers. Question number 23. A group of people organized for a particular purpose is known as option A, community, option B, society, and option C, institution, and option D, association. Correct answer is option D, association. Question number 24. What the name did Freud give to his model of development, which comprises id, ego, and superego? Option A, genetic model, option B, unconscious model, option C, topographical model, and option D, structural model. Right answer is option D, structural model. Question number 25. Which of the following is the element of difference between community and society? Option A, definitive locality, Option B, a group of persons. Option C, sentiment of oneness. And option D, likeness of interest. Correct answer is option A, definitive locality. Question number 26. If a person has an object implemented in his hand, the first aider must, option A, only break the object if it is hinders the transportation. Option B, breaks the object from where it is visible. Option C, immobilize the object using a sterile pad. And option D, try to remove the object pulling it. Right answer is option C, immobilize the object using sterile pad. Question number 27. What does a society exclude? Option A, time boundless. Option B, difference. Option C, reciprocity. Option D, interdependence. Right answer is option A, time boundless. Question number 28. Which committee was set up to see the general condition of a nurse? Option A, High Power Committee. Option B, Bohr Committee. Option C, Mudaliar Committee. And option D, Mukherjee Committee. Correct answer is option A, High Power Committee. High Power Committee was set up to see the general condition of nurse. Question number 29. What is the approximate total population of India as provisional data of 2011 census? Options A, 121 crore. Option B, 160 crore. Option C, 150 crore. And option D, 180 crore. Correct answer is option A, 121 crore. According to 2011 census provisional data, total population of India is approximately 121 crore. Question number 30. Which of the following is the purpose of hand washing? Option A, to provide comfort. Option B, to prevent cross infection. Option C, to have aesthetic feeling. Option D, to promote circulation of hand. Correct answer is option B, to prevent cross infection. Question number 31. Anxiety is caused by option A, hostility turned to self. Option B, masked depression. Option C, an objective threat. And option D, a subjective and perceived threat. Correct answer is option D, a subjective and perceived threat. Anxiety is caused by a subjective and perceived threat. Question number 32. What is hyperemesis gravidarum? Option A, food craving. Option B, excessive vomiting. Option C, morning sickness. And option D, lethargy. Correct answer is option B, excessive vomiting. Hyperemesis gravidarum means excessive vomiting. Question number 33. Immediate first aid treatment for a dog bite is option A, suture the big wound. Option B, cover the dressing. Option C, wash with soap and water for 15 minutes. Option D, apply antiseptic lotion. Correct answer is option C, wash with soap and water for 15 minutes. Question number 34. Dissemination of research can be done by following methods except option A, oral presentation. Option B, publication in scientific journal. Option C, poster presentation. And option D, information discussion. Correct answer is option D, information discussion. Dissemination of research can be done by following methods except information discussion. Question number 35. The color used for tagging a dead body is option A, yellow. Option B, black. Option C, red. And option D, green. Correct answer is option B, black. The color is used for tagging a dead body is black. Question number 36. The ratio of cardiac compression and artificial breathing is option A, 60:6. Option B, 50:2. Option C, 30:2. And option D, 12:3. Correct answer is option C, 30:2. Question number 37. The definition of health by WHO includes all except option A, mental. Option B, physical. Option C, reproductive. And option D, social. Correct answer is option C, reproductive. Question number 38. The neural tube defect among newborn can be prevented by providing option A, folic acid to the mother in the first trimester, option B, vitamin K to the mother in the first trimester, option C, iron and folic acid throughout pregnancy, option D, iron to the mother in the third trimester. Correct answer is option A, folic acid to the mother in the first trimester. Neural tube defect among newborn can be prevented by providing folic acid to the mother in the first trimester. Question number 39. Which of the health education agency is at national level? Option A, Press Information Bureau. Option B, Central Health Education Bureau. Option C, Doordarshan. Option D, IES Bureau. Correct answer is option B, Central Health Education Bureau. Question number 40. An Anganwadi worker caters to which size of population? Option A, 1000. Option B, 100. Option C, 1 million. And option D, 1 lakh. Right answer is option A, 1000. An Anganwadi worker caters 1000 population. Question number 41. Which is not the responsibility of a head nurse or ward in charge? Option A, preparing patient bill. Option B, nurse's assignment. Option C, delegation. And option D, patient care. Right answer is option A, preparing patient bill. Preparing patient bill is not a responsibility of a head nurse or ward in charge. Question number 42. Secondary level of prevention of disease includes option A, early diagnosis and treatment, option B, rehabilitation and disability limitation, option C, specific protection and screening, and option D, screening and immunization. Correct answer is option A, early diagnosis and treatment. Question number 43. What is the normal blood cholesterol level? Option A, 500 to 100 mg per dl. Option B, more than 200 mg per dl. Option C, less than 200 mg per dl. And option D, 1000 to 15 mg per dl. Correct answer is option C, less than 200 mg per dl. Question number 44. Attributes of a good leader involves which of the following? Option A, aware of members' strength and weakness. Option B, suppresses the voice of dissent. Option C, do not hold accountability for wrongdoing. And option D, not sure about his or her skills. Correct answer is option A, aware of members' strength and weakness. Question number 45. Hallucination is option A, misinterpretation of real external stimuli. Option B, perception without stimuli. Option C, clear perception of stimuli. And option D, wrong perception of stimuli. Correct answer is option B, perception without stimuli. Question number 46. The nursing profession can only be practiced after option A, approval, option B, validation, option C, licensure, and option D, accreditation. Correct answer to the question is option C, licensure. Question number 47. How many calories are provided by 1 gram of protein? Option A, 8, option B, 10, option C, 4, and option D, 6. Correct answer is option C, 4. 4 calories are provided by 1 gram of protein. Question number 48. Exogamy is defined as option A, compassionate marriages, option B, marriage outside a group, option C, experimental marriages, and option D, marriages within a group. Correct answer is option B, marriage outside a group is known as exogamy. Question number 49. Validity of a tool refers to option A, feasibility, option B, consistency, option C, accuracy, and option D, acceptability. Correct answer is option C, accuracy. Validity of a tool refers to accuracy of the tool. Question number 50. Cancer of cervix is caused by option A, human immunodeficiency virus, option B, human diploid virus, option C, human papilloma virus, and option D, rotavirus. Correct answer is option C, human papilloma virus. Question number 51. Normal duration of involution of uterus is option A 6 weeks, option B 2 weeks, option C 1 month, and option D 2 months. Correct answer is option A 6 weeks. Question number 52. Culture has importance for the group because of option A, it provides stability to the group, option B, it satisfies human needs of food and shelter, option C, it marks off one group from another, option D, it keeps social relationship intact. Correct answer is option C, it marks off one group from another. The culture has importance for the group because it marks off one group from another. Question number 53. Displacement, substitution and projection are examples of which of the following? Option A, psychosocial stage of development. Option B, defense mechanism. Option C, psychosexual stage of development. And option D, neurotic need. Correct answer is option B, defense mechanism. Question number 54. Which of the following measure is central tendency? Option A, mean. Option B, range. Option C, standard deviation, and option D, ratio. Correct answer is option A, mean. Question number 55. Total number of deciduous teeth in the children are option A 6, option B 14, option C 12, and option D 20. Correct answer is option D 20. Total number of deciduous teeth in the children are 20. Question number 56. Norm in sociology indicates option A, ethical ideas of society, option B, tendency of human being to move up, option C, normal standards of social behavior, option D, standardized generalization about normally expected modes in behavior. Correct answer is option D, standardized generalization about normally expected modes in behavior. Norm in the sociology indicates standardized generalization about normally expected modes in behavior. Question number 57. Communication process includes option A, message, messenger, channel, option B, communicator, environment, feedback, and option C, communication, message, channel, receiver, and feedback, and option D, communicator, receiver, and feedback. Correct answer is option C, communicator, message, channel, receiver, and feedback. Question number 58. What is the dose of vitamin A for an infant at 9 months of age? Option A, 4 lakhs international units. Option B, 3 lakhs international units. Option C, 2 lakh international units. And option D, 1 lakh international units. Correct answer is option D, 1 lakh international units. The dose of vitamin A for an infant at 9 months of age is 1 lakh international units. Question number 59. Sample in research is referred as option A, representative of population, option B, high risk study subjects, option C, high risk population, option D, population living in defined area. Correct answer is option A, representative of population. In research, the word sample indicates representative of population. Question number 60. The tool used for data collection are option A, experimental and non-experimental, option B, participant observation and information booklet, option C, survey and observational checklist, option D, questionnaires, interview schedules, observation checklist. Correct answer is option D, questionnaire, interview schedule, and observational checklist. The tools used for data collection are questionnaires, interview schedule, and observational checklist. Question number 61. Telling the truth is practice of which ethical principle? Option A, non-maleficence, option B, justice, option C, beneficence, and option D, veracity. Correct answer is option D, veracity. Telling the truth is the practice of veracity ethical principle. Question number 62. What immediate nursing intervention will you take in case of blood transfusion reaction? Option A, monitor vital signs. Option B, inform blood bank. Option C, inform physician. And option D, stop the transfusion immediately and monitor vital signs. Correct answer is option D, stop the transfusion immediately and monitor vital signs. Question number 63. The pacemaker of heart is option A, Purkinje fibers, option B, bundle of His, option C, SA node, and option D, AV node. Correct answer is option C, SA node. The pacemaker of heart is known as SA node. Question number 64. Absence of breathing is known as option A, eupnea, option B, apnea, option C, tachypnea, and option D, bradypnea. Correct answer is option B, apnea. If you have any doubts regarding this video lesson, please feel free to post a comment in the comment box. If you are new to this video, please subscribe this channel and press bell icon all for new upcoming videos. Thank you once again. Wish you a good day.